name is Kathy, and today I'll be discussing bladder disorders. Let's start with urinary tract infections. First off, we should go through some of the symptoms of this ailment. There is a burning pain in the region of the bladder, frequent urination, and a desire to pass urine when unable to do so, even when the bladder is empty. There may be a slight fever or even a high fever, little or no appetite, great thirst, and depression. The urine is cloudy, acid, contains mucus and sometimes red sediment, pus, or even blood. First off, drink 8 to 10 glasses of water a day to help flush out the bacteria. Then take 5,000 milligrams of vitamin C every 4 hours for the first day, and then reduce the dose to 1,000 milligrams of vitamin C every 4 hours for the next 3 days. Take garlic capsules as prescribed on the bottle. Drink hot catnip tea, stinging nettle, and bearberry tea 4 times a day. Catnip and bearberry tea is made by steeping 1 teaspoon of the combined herbs in a cup of boiling water and let it sit for 5 minutes before drinking it hot. The next step is to take an enema of hot catnip tea, as hot as you can take it. Repeat 2 to 3 times, holding the catnip tea in as long as possible. Next, take a hot bath and scrub yourself thoroughly so that your skin, the largest elimination organ of your body, is fully functional. After that, make a tea out of equal parts of fennel seed, burdock, slippery elm, and cuba berries. Steep 1 teaspoon of the combined herbs in a cup of boiling water and let steep for 20 minutes. Drink 1 cup of the cold tea before each meal and at bedtime. Drink unsweetened cranberry juice is also beneficial. Many people have found relief from using a heating pad or a hot water bottle on the affected area to help soothe the area. Avoid caffeine, alcohol, spicy food, nicotine, carbonated drinks, and artificial sweeteners. Keep emptying your bladder, even if it's just a small amount. Get rid of it because each urination gets rid of a little bit more of the bacteria. Now, for issues of incontinence, bedwetting, and overactive bladder, eating pumpkin seeds is very beneficial for this. And you can make a tea out of equal parts of dandelion, saw palmetto, bushu, cleavers, horsetail, corn silk, valerian, and plantain. If you can't locate all of the herbs, just use what you can. Gosha Ginkgo Gan is an oriental mixture of herbs that is somewhat like a green tea and is very beneficial for this condition as well. Just follow the directions on the box. Now, bladder infections respond well to homeopathic treatment. The trick is to find the correct remedy for your particular situation. Homeopathic remedies have no side effects and will work like magic if you find the right remedy. If not, then nothing will happen at all. You can try 4 homeopathic remedies at a time until you find the right one. Staphysagria is very useful for treating the honeymoon cystitis. This is a term used to describe bladder infections which develop after having sex. When needing to urinate, the woman might feel she has to get to the toilet as fast as she can or else she might leak. Infections characterized by an intense, scalding pain when passing urine may be helped by cantharis. There may be blood in the urine, and there is a sensation of not being able to fully empty the bladder or the rectum. Unexpectedly, the irritation of the bladder may increase sexual desire in the person. Bladder pain, which comes on suddenly and intensely, with an extremely urgent need to pass urine, points to pulsatilla. The person may crave open air and moving about and feel worse indoors. Natrium muriaticum is good for stress incontinence. The person might also have vaginal dryness and pain on intercourse with an aversion to sex. Many of the symptoms might be worse from direct or bright sun and around 10 a.m. Apis is valuable for stress incontinence that is better in cooler weather. It may be associated with bladder infections with severe burning pain when passing urine. People needing apis may feel generally worse when hot. Sepia is a very important remedy in older women, in particular where urge incontinence is associated with a sensation of the uterus prolapsing, or it feels like everything's falling out below. There may also be an itchy, sore vagina with a white discharge. Chilliness, sensitivity to cold, and feeling better after aerobic exercise are also common symptoms for this. Nux vomica patients have frequent urging, yet are unable to empty their bladder satisfyingly. Like sepia, they are chilly and sensitive to cold. Their symptoms may be worse for periods of overwork or indulgence in alcohol, overeating, tobacco, or coffee. Bedwetting. Causticum is a useful remedy for numerous bladder problems, including bedwetting. The child may describe dreaming of urinating when they wet the bed. They may be sensitive to the cold and draughts and feel generally better in rainy, cloudy, or damp weather. Mercurius symptoms are all worse at night. Children needing mercurius are sensitive to minor changes in temperature, both hot and cold. They perspire at night and salivate, even drooling onto the pillow. Bad breath and a metallic taste in the mouth is also typical. Beside wetting their bed, children needing Baryta carbonica will sometimes have recurrent sore throats and tonsillitis. In between throat infections, their tonsils may remain massively enlarged. They may also have swollen lymph glands in the neck. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.